Well, good morning, everyone. Good afternoon. I hope everyone's having a safe and healthy week here as we enter June. My name is Anna Monsour, and I am the Director of Strategic Executive Partnerships here at PracticeSuite. And I am very proud to have Relation on board in our partner marketplace. Using patient engagement solutions to communicate with your patients outside the four walls of your practice is a need that all of us are being presented with today, not only during the COVID-19 pandemic, but also as we start to enter hurricane season and other various factors that are that require us to communicate with our patients. So healthcare organizations have been using patient engagement platforms to keep patients safe, informed during viral outbreaks, natural disasters, and other major disruptions. I'm proud to introduce Rodney Kerrigan. He will be presenting our solution for today. And if you have any questions, there is a question box at the end. We will be recording this presentation, and we will be following up with you after today with an email. That email, we would appreciate if you would fill it out. It allows us to tweak and add to our content on these webinars. But we appreciate you spending your lunch break or just 30 minutes with us for today. All right, Rodney, I'll turn it over to you. Thank you so much.
All right. Thank you, Anna. As Anna mentioned, my name is Rodney Kerrigan. I work with Relation, and we're excited to have partnered with PracticeSuite for this new launch of patient engagement tools for a lot of the needs that Anna mentioned. Before we walk through those different solutions, I just want to touch on a little bit about Relation so that you understand who we are and now that we're in the PracticeSuite marketplace. We were started in 2014. As you can see there, we work with a large number of providers. We're actually in all 50 states now. Really excited about that. And our communication engine is really, we take the approach of using really multimodality, text, email, and voice communication really for all of our solutions. And throughout the year, we're going to have a number of releases of different types of products on our platform. But today, we're going to talk through those that are available to you all today for a lot of the needs that Anna mentioned. With our new PracticeSuite partnership, we now have the ability for an API integration for bidirectional communication with the PM system. And really all that means for you as the end user is everything is set up between PracticeSuite and Relation to really function automatically based on the setup that you all do with our implementation team. So day to day that you all don't really have to be involved with who we possibly survey, who we send reminders to. All of that is set up to work as you all see fit or through best practices after setup initially. Our platform is HIPAA secure, TCPA compliant, which is critical with what we do in patient engagement. We monitor all the outreach that we send your patients on your behalf to be sure that we do not violate any of those guidelines that are in place. We're built on AWS platform. We're SOC 2 certified for HIPAA security. And again, we take a patient-centered approach to engagement. We're not really trying to replace an app or a portal. We're really just trying to be an adjunct to work alongside those apps or portals where the patient doesn't necessarily have to use a username or password, and they're able to quickly respond back, whether it be by text, email, or voice for our different solutions. One thing I do want to point out there, you see in the top right, we did win patient outreach for 2020. We were the class category leader. That's something really we're proud of. It's really a Consumer Reports when it comes to healthcare, and they reached out to a large number of our current clients, and we were awarded #1 in patient outreach for 2020. I won't spend a lot of time on that. I just wanted to quickly share the report card. A couple of things that I always like to point out is two that we're the most proud about is we have scored a perfect score on does Relation keep all promises and would you purchase again? So really just wanted to share this to give you all an understanding of the credibility of the Relation and why PracticeSuite chose to partner with us for these patient engagement tools. So let's talk a little bit about the different products that are available today. As I mentioned with our API integration, this is really all meant to function in an automated fashion. And it really gives you the ability with a simple appointment reminder, even to chat with patients through the entire patient journey. Phone communication is still needed and necessary for a large part of the demographics. But when it comes to an appointment reminder, for example, like you see on the right side of the screen, you even have the ability to chat with the patient. If they needed to reschedule for some reason, cancel, maybe they have a quick question about their appointment. And we'll touch on a lot of that within the actual product demo. But a big benefit for you all with what PracticeSuite is doing with Relation for the patient journey and the different patient engagement tools that will be coming out through 2020, you're really able to chat with patients through that entire process through the platform. The first product I want to share about that's available today is our appointment reminder process, our appointment reminder solution. And what I'm sharing here is our best practice model. If you all use a different solution or have a different opinion on, or really just past experiences of what may work best for your demographics, everything is customizable by appointment type, provider, and location. But just to share our best practice, this is typically what most practices start with. Typically, it's an email 5 days out from their appointment, followed up with a voice message that goes out 3 days prior to their visit, and then a text message that would go out 48 hours before the visit. You can see each subsequent message is sent really only if they did not respond to the previous message. We don't want to ask them to repeatedly confirm their appointment. Once it is confirmed, benefit to you as the user, we can tell you that within the PM system so that you can see it within the schedule that a patient did confirm, cancel, or reschedule. You do have access to our dashboard for some additional reports that I'll share with you shortly. But again, really on a daily basis for your staff, as patients are responding, given our integration with PracticeSuite, we're able to tell you within the system if a patient did confirm, cancel, or reschedule. Now, once the patient does confirm their appointment, we are going to still remind them one last time prior to their appointment. You can see there on the right, day of, 7 a.m. text message. That's an example of a close proximity message that can be set up with the practice. Typically, it goes out the evening before or the morning of the appointment. It's a quick message by text. Doesn't really give the patient the ability to cancel or reschedule, being that we're within 24 hours of the appointment. What it's really designed to do is help lower no-show rates, because the number one cause of a patient not showing for their appointment is typically just truly forgetting about their appointment. And that way, if they did confirm 3, 4, 5 days ago by voice or email or even text, we still want to follow up with them a little bit closer to appointment time just to be sure they don't forget. But again, just remember, all of this is really configurable as you all see fit. It's all driven by appointment types, providers, and locations, so that certain things can be said about different types of visits. New patient versus returning patient, maybe a procedure that needs to have certain instructions said. All that can be set up with the implementation team. Now, from the patient's perspective, again, the scripts can be customizable. Typically, it has the practice name. We can mention location if you have multiple locations within the practice. We can list the name of the provider if you like. And then again, they can reply back 1, 2, or 3 for confirm, cancel, reschedule, and that's written back into the PM system. Now, again, just to point out, with the messenger two-way chat feature that's available with the system, this is an example also of where if a patient did not respond with a 1, 2, or 3, and maybe they tried to text back something different, this is where, you could get into having a conversation via text versus having to play phone tag with that patient. And on the right are just some quick stats just to reiterate how powerful text message communication is. Not as many use the email or interact with the email notification that goes out, but I will say it's the most effective about sending additional information. It can be just like the appointment text reminder. It can be set with your logo, maybe directions and different plugins as far as refer a friend, find us on a map if they're a new patient or if you have multiple locations. Again, just to be sure they get to the right place, right time, right reason. And then the bottom there where you see the welcome message with the bullet items, that's where you can make that specific by appointment type if there are certain things that need to be said to different patients. Now, Anna mentioned this initially at the beginning of our call, but there are a few tools that come with the ability for appointment reminders and two-way chat that are available today. Unfortunately, if a patient still did not show for their appointment, you can use our system to reach out to those who did no-show with our no-show engagement tool. And that way, the following day, based on the appointment statuses and the information that's in PracticeSuite, we can send out a quick message by text or by phone call with an email backup, trying to get that patient reconnected back to the office to hopefully get that no-show message or that no-show rescheduled for a future day and time if you would like to set that up along with the appointment reminders. You also have the ability with hurricane season coming. Unfortunately, a lot of practices that use our system have had to use it for COVID-19, as Anna mentioned. You have the ability to send demand messages, really a broadcast type tool, to where certain providers, maybe a location's closed, maybe a certain appointment type can't be seen for a certain day, maybe a provider's running late, like the example you see there at the bottom. It's really just a tool just based on inclusion, exclusion criteria, again, because of the integration that we have with the PM system, to where you can quickly pick who you would like to contact and then send a quick message. And I'll show you an example of that here in just a few minutes within the actual dashboard. Now, alongside the ability to reach out to a patient who no-showed their appointment, post-appointment, you also have available today the ability to add a survey solution. And there are really three options you have there. You can run a practice CAPS survey if you're wanting to get feedback for a credentialed CAPS type survey. Typical visit survey that most of you have taken in other industries, or maybe even within your practice, where you're just really trying to get feedback on the visit, how the patient experience went with cleanliness, quality of care, likelihood to recommend to a friend, those type examples. But the majority of our practices do use the reputation management solution for surveys, just because it's really a way to help build up online reviews. And so again, it goes out in an automated fashion post-appointment based on if a patient did or did not come in for their visit, and it's sent by text. And the first question that they receive is overall experience with the practice. And really, depending on how they answer this question, they're really going to go one of two ways through our survey product. If it's a positive patient who scored this question that you see here on the screen with a 4 or a 5, we're going to say, we're pleased to hear you had a positive experience. Would you mind taking a few minutes just to complete a survey on the practice? And then we immediately drive that patient to the review site that you have chose at the practice level. It can be provider specific. If one provider doesn't have a lot of feedback on a certain review site, like Vitals or Health Grades in this example, or Google reviews or wherever, we can do it provider specific, or we can do it for entire locations. Really, however you want to set that up to where you can build up those online reviews on the practice. Response rates, the reason behind this is just to really see an uptick in response rates. The majority of the time, patients don't proactively think to go leave a review on the site. Some do, but this tool just gives you the ability to prompt more patients within the practice with an ability to leave a review, to where you can get more reviews left on different review sites that are out there, especially if new people are moving into the community or new patients are just searching out for a new provider. Now, if you recall, when the previous screenshot there, it was the overall experience question was a 1 to 5 scale. Now, if a patient did score that question, unfortunately, with a 1, 2, or 3, we do want to prompt them with a series of questions just to better understand why they may have been unhappy with their visit. There's a comment box at the end where they can leave whatever feedback they would like. They can provide their name and phone number if they'd like to be contacted by the office. It can be kept anonymous if they would like to, just to hopefully promote honest feedback. And then from that point, it's really up to your discretion. If we direct that patient to a review site, those are a lot of things that you will talk through with the PracticeSuite and Relation team during implementation on how you would like to set it up. But again, we just want to get feedback for you from how you can improve, but also help build online reviews up with sending these out to new patients, maybe all patients for a short time, however you see fit. And I mentioned some of this, but just again, to reiterate, you would have a dedicated implementation team and project manager from the PracticeSuite team and the Relation team. There's training that leads up to that go live. Even after post go live and post QA, there's always weekly webinars we have set up that are standing calls if there needs to be trainings for certain things, or maybe someone gets hired that needs to better understand the dashboard. Those are going to be available to you after go live. So I would like to spend just a few minutes within the Relation PracticeSuite dashboard, just to give you a better understanding of product functionality. Again, this is what's really part of your implementation process. This is what you would all be trained on to before you go live with the system. So if you recall, at the beginning of our presentation, I had talked about our API integration with PracticeSuite. And again, on a daily basis, you wouldn't necessarily have to access this dashboard that we're in here. This is available to you for a couple of solutions, but also just for being able to run different reports if necessary, outside of being able to see if a patient does confirm, cancel, or reschedule their appointment within PracticeSuite and the PM system. So when you first log into the dashboard, you're presented with really the reminders that had went out for the day before. And that way, outside of just confirm, cancel, reschedule, you can see if some of the messages have been sent but still unresponded to. Possibly we sent the email, but they just viewed it and didn't respond to it. More importantly, if it was a bad email or a bad phone number, that's also logged to where, one, you can see it here and they're all interactive to where you can look and see the patient's name and the day and time of the appointment. But you can also run reports within the system, for example, with the appointment reminders, to where you could pick certain locations, providers, and even drill down to certain types of appointments, and then look at the information that we were just on within that performance dashboard. And if you wanted to look at it for maybe all your locations, or maybe you wanted just the feedback for one specific location for that particular date range, everything that had been on that bar graph on the homepage would be more here in list form that can be exported as a CSV file, PDF, filtered by responses. So again, that you could use this to then maybe update or make note of that on the patient's chart, that when the next time they come in, they may need to have their email address or their phone number updated within the system. Same type of reports would also be able to be run for the no-shows. So if you did have anyone who did receive a no-show message based on what we see in PM, you can also run a report for that, to where you could use that to then follow up to hopefully get those patients rescheduled. You always have the ability to come in and search for a patient particularly. So that way if they didn't get, or if they came in, I should say, to the office and say they didn't receive a certain message, you can go in here and search for a particular patient's name, look at the messages that were sent to be sure that the right day and time were mentioned in the message without having to reach out to the support staff of Relation or PracticeSuite. Now, we talked about the messenger chat feature that's within, comes with the appointment reminders. And there's really two functions here. And one that I didn't mention during the PowerPoint presentation was also the ability to add on the ability for what's called secure messenger. And so this is where really by location, as you see here, if you have multiple locations, this entire dashboard that I'm in is really beneficial for you all if you have multiple locations, because you can set role-based privileges for who should or shouldn't have access to this dashboard. And so when it comes to Messenger, for example, if I'm a user at the front desk at the Nashville location, it can be set up during implementation to where I may only be able to chat with patients who are to be seen at the Nashville location. A lot of times if it's a super role or someone who can have access to the entire practice's locations, you can see here that you can chat really with anyone from any of the different locations. And again, going back to the example within the PowerPoint, if there was an appointment reminder that was sent and they were to say something other than 1, 2, or 3 for confirm, cancel, reschedule, it would come into this dashboard. The appropriate people on staff would be alerted that there's a new message that needs to be responded to. And then you can truly just text back with that patient, and they would receive it on their device, just like they would receive a text from any friend or family. Now, taking two-way chat a step further, there's also the ability for secure messaging with patients. Meaning if there's ever a time to where you needed to chat with a patient, maybe from a clinical perspective, or a receipt maybe needs to be sent, maybe you want to exchange insurance information or driver's license, one, the patient can send that securely through the patient center. You can send an attachment from within PM system here with a quick text message. And really all it is you would be able to write up your message, toggle on the ability for secure messenger, add your attachment, and then send the message to the patient. Benefit with this is, again, our system is really designed not to be where a patient has to log in with a username or password. So when you send a secure message with our integration with PracticeSuite, the benefit is the patient gets to use their personal information to identify who they are. And so it's typically just first and last name with date of birth that's in PM system. We use the phone number and email address that's on file for the patient. They receive a short code back to their phone, and then they basically two-factor authenticated who they are, to where then we can present them with the message that was sent securely so they can view that. Outside of that, you can always chat with patients unsecurely via SMS text. but this just is an added feature of the system if you have a need within the practice to truly chat with patients from a PHI perspective. Now, alongside the Messenger product, there's also the ability to send demand messages, the broadcast tool that we talked about that Anna mentioned for those different types of examples. And this does really work alongside the Messenger product, to where you can pick which locations, possibly which providers should get the broadcast message that you're going to send, the different appointment types, and possibly even pick a time on the schedule. So again, providers running late, maybe they're not in until 11 o'clock on Monday. If you wanted to send out a quick voice, text, or email today, you could pick that time frame on the schedule for Monday, say 6 a.m., for example, just to cover all appointments, and possibly go through 11 a.m. And those that are on the schedule with PM for, let's say, just this one location, possibly just for this one provider, Dr. Bryant, would be the ones that would receive the message that you would work up by voice, text, and email. Any combination can be sent. The benefit to you at the practice is you can also save favorites. So if they get used fairly often for inclement weather, provider running late, whatever it may be, they can be saved to where you could then quickly pick those. And then once the message by voice, text, and possibly and/or email is the way you would like it, you just send it to the queue and then the system sends it out. Again, you as the user have complete autonomy over this. A lot of vendors in this space, you have to send in support tickets that may be affected by time zones and messages don't go out as quickly as you would like. We've really designed this to where when you come in and you work up a message to be sent to a patient or a group of patients, when you send it to our system, it's sent out when you tell us to do that. So you're in complete control of the messages that go out. One other thing I would like to point out is that there's also the ability for different tags, and we would train you, of course, on this during implementation. But the reason for that, again, going back to your criteria that you set on who you're sending the message to, it can possibly be a large number of patients that receive this broadcast message. And with using the tools, the different tags that were within the system, you'd be able to set up possibly to say the arrival time of the patient, the appointment day, the appointment time, the physician that patient's supposed to see, the patient's actual name. And so that way, when you send a broadcast message to a larger group of patients, they're all going to hear it specific to their day and time of appointment. Their name will be mentioned in the text or the voice message or email, and the physician's name could also be mentioned. One thing I do want to point out, if you do send a text message, the benefit of this also with the ability for two-way chat is if you were to send a text message to a patient and you want to have a call to action be really just to have a chat with the patient, or maybe you want to present them and tell them to call the office to take care of the matter, you can do that. But the benefit here is you could send a mass message, and then the patient, again, going back to our messenger chat, if necessary, they could respond back to that broadcast message and chat with the office versus having to call. Because again, this all goes back to making it easy on the patient, given a busy lifestyle, having to be at work at certain times of the day, and they can send messages when convenient with them. And the same goes for the practice, to where when you have time in between patients, you can respond back to these messages from the front desk. So Mike, Anna, I know we have just a few minutes left. I would like to open it up for questions if there have been any, and then we can spend the last few minutes touching on those if you all would like.